Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights. The Adamawa State government increases capacity to manage coronavirus as it establishes an infectious diseases center, lays foundation for Cottage Hospital. Delta State schools set for resumption as state government distributes supplies. And India coronavirus situation worsens as confirmed cases surpass 5 million. Five people have died from COVID-19 in Nigeria in the last 24 hours, putting the death toll at 1,088. Lagos has recorded the top highest deaths in Nigeria, followed by Edo, the FCT, River State and Kano State. They've all recorded over 50 deaths since the outbreak. The Nigeria Center for Disease Control also reported 90 new cases from 8 states, with Lagos leading the pack with 33. Other states with new cases include Plateau State at 27, Kaduna 17. Ogun State recorded 6 new cases, the FCT 4, Anambra 1, Ekiti and Nasarawa 1 each. In the meantime, global numbers of COVID-19 inches to the 30 million mark, the number of recoveries as well close to 20 million. According to the World Health Organization, the tallies probably reflect only a fraction of the actual number of infections, as many countries are testing only symptomatic or the most serious of cases. A COVID-19 update in Africa shows a total 1,360,635 with 32,809 deaths and recoveries at over 1.1 million. The Nasarawa State government is ramping up testing aimed at flattening the coronavirus curve in the state. Here's our correspondent Halima Gayam with more.
The first case of the coronavirus in Nasarawa State was recorded on the 27th of April 2020. 5 months down the line, the state now has 446 confirmed cases and 12 deaths. Governor Abdullahi Saleh attributes this to concerted efforts.
We have been very lucky in Nasarawa State. Up till this moment, we are still around 446 total number of infected. It is not because of any magic that we are doing, but I strongly believe the effort that we put in and the support that we continue to receive from the Almighty Allah is what is keeping us and guiding us to this level.
So far, 3,711 samples have been collected in the state, and they were all taken to the NCDC laboratories in the Federal Capital Territory, Abuja, which usually comes back after some days. The era of such will soon be a thing of the past. The state government advisor on health reveals.
The state already have a place in Kefi that we are doing our testing. The one in Lafayette, I won't give you a date specifically, but pretty soon. Our lab is ongoing, as you're aware. NCDC have kicked the ball rolling. We have our staff trained already. So as soon as the place is commissioned, most definitely we will start testing.
Once the edifice is in place, the state would take testing to the locals, civil servants, among others. With this, the state could witness a spike in the number of confirmed cases as more testing amounts to more revelations. Halima Gayam for COVID-19 update.
More tests are to be carried out among citizens in Plateau State following the rise in the number of positive cases to curb community spread of the virus. According to the State Ministry of Health, 29,792 samples have so far been collected, with a total number of 3,142 confirmed, over 2,000 discharged, and 1,015 cases are active. 31 deaths have also been recorded, with 8 patients absconding from the isolation center. One of the test centers in the state, located at the National Veterinary Research Institute, resumed activities after a while and has been receiving samples from states in the northern part of the country with a capacity to test 1,000 samples a day.
The laboratory is a biosafety level 3 laboratory. That means it is a very high level laboratory that can handle not just the coronavirus but other highly infectious organisms. We are able to do up to 1,000 tests per day, but we have not done that. But so far, we have tested over 30,000 samples in our laboratory since it was accredited for testing. But by way of a slight challenge, now that the samples are building up, we need to increase our storage capacity.
In Plateau State, you know that the testing centers have increased. Now testing is going on in Plateau Hospital apart from NVRI in VOM, and the PTF itself has said categorically that most states have stepped down their testing. But Plateau State continues to test communities. As I talk to you, we have virtually tested about 70 to 80% of the civil servants. Local governments have started testing. Communities are testing.
Now, most state governors appear set to close the gap in the health sector exposed by the COVID-19 pandemic. Adamawa State Governor Umaru Fintiri, during the foundation-laying ceremony of 2 cottage hospitals in the state, promised that a lot more is being done to uplift the sector. The governor is concerned that despite the growing population, successive administrations in the state did not consider the importance of building befitting health facilities, which has made the fight of the pandemic more cumbersome.
The COVID-19 pandemic has not only brought about a new normal globally, but it has swept through countries unannounced. In Nigeria, the pandemic exposed the setbacks in the health sector, which some governors like that of Adamawa State are now trying to correct. It's against this backdrop that the state is invigorating its drive towards providing adequate health care for its residents as a way of checkmating the community spread of COVID-19. Residents of Gombe and Gire turn out in their large numbers from across the local government areas to witness the foundation-laying ceremony of a new cottage hospital for them. Governor Umaru Fintiri, accompanied by members of the State Executive Council, state legislators and stakeholders, performed the ceremony. A community leader from Gombe says he's appalled by the havoc wreaked on the sector by previous administrations, while the Commissioner for Health appeals for support to turn things around.
So terrible on health challenges. When you have a sick person, you have to go to Garkida, or you go to Hong, or you go to Yola. You can now see that you need to cover a long distance before you get to see a doctor.
The cottage hospital is a 60-bed capacity hospital with all the clinical departments inclusive.
This treatment center in the state.
For the governor, this may not be the right time to trade blames, but the time government should work with all citizens of the state and ensure that the primary healthcare system is revived.
My government is taking every step to ensure that our primary healthcare system is made resilient and fortified enough to address emerging challenges.
For many witnessing today's event, the expectation is to see a rapid construction work that will bring about the completion of the cottage hospital, as this is one of the ways to prove that government is not paying lip service to healthcare.
Well, let's continue with discussions with regards to how we can flatten the coronavirus curve. Joining us from Abuja studio is Mrs. Henrietta Yakubu. She's the General Manager, Corporate Affairs Department with the Federal Airports Authority of Nigeria, FAN. Thank you so much for joining us this afternoon.
Good afternoon. Thank you for having me.
First, tell us about the new normal for airport operations following the resumption of flights for both local and international.
We have slightly different protocols for departing and for arriving passengers. For departing passengers, we expect them to come to the airport 3 hours before their flight time. They're supposed to come with their nose masks on. Outside the terminal, we have put in place canopies. Their luggages will be disinfected outside. Their temperatures will be checked outside, and then they are also expected to observe the 1.5 physical distance between them and the person ahead of them. When they are done with all of this outside the terminal, they now go in, they will walk through the screening machine, their luggages will be screened, and they go in and head to the airline they're traveling with. When they're done with all of that procedure, they now go to the immigration. From the immigration, they now proceed to their boarding gates or to the lounge, as the case may be. But for arriving passengers, they are supposed to go to the NCDC portal and, get the health document online and fill it. Or some airlines in the aircraft give out these forms. Passengers are supposed to fill these forms on board, because once they disembark from the aeroplane and they have joined the queue and they're heading towards the port hall for them to be screened, these forms will be checked and be taken from them. And every passenger is supposed to come with the COVID-19 negative test result. They're supposed to do this 96 hours before their flight time or 72 hours, as the case may be. If you don't come with a negative result, you will not be allowed. First and foremost, you may not even be allowed to board the aeroplane. But once you land and you join the queue, you get to Port Health, they will go through this health form that you were supposed to have filled either on board or online. You're supposed to fill in all the details, your name, your address, fill everything in detail, and then submit your negative results. Your temperature will still be checked, and then from there you proceed to the immigration, and then you get into the arrival hall where you pick your luggage and you exit. But if you don't come with that result and somehow you are able to board the aircraft and your temperature is checked, the port health officials right from the airport will take you. If you land in Abuja, they will take you right from the airport to the Women Development Center. You'll be quarantined for 7 days at your own cost. And then you're expected to pay for the test to be done while you're on quarantine. If you're in Lagos, you'll be taken to Ibis Hotel, where you'll also be quarantined for 7 days, and you're also expected to pay for the COVID-19 test. While you're there, if unfortunately your result returns and it is positive, of course, you'll be quarantined again, and then the contact tracing will begin. And the airline that carried you in the first place will also be disciplined. We've been told that $3,500 is the charge the airline will pay for carrying a COVID-19 patient. So we advise all passengers before they board, please, it will do yourself a world of good if you have your negative results with you. Of course, there are some countries that don't really bother about that, UK, for example. But if you're not traveling directly to UK on BA and you're transiting, it will do you well to have this test negative result with you. So we encourage passengers leaving Nigeria and coming into Nigeria to ensure that they have this test result with them, because it's something that will be checked on arrival by the port health officials in our airports.
All right, we just have a few more minutes before we let you go. And I'd just like to quickly ask how you differentiate the test results, because the PTF raised the alarm that some international travelers from specific countries who might be COVID-19 positive were presenting fake PCR results.
In Nigeria, I know that there are laboratories that have been designated in Abuja and Lagos where you're supposed to go and have these tests done. But for people that are coming into the country, it is the results that they present that we work with. But that is why when they come into the country, the port health officials in the airport still ensure that their temperatures are taken. And then that form they're supposed to have filled on board or online will also be cross-checked to ensure that they are not positive to COVID-19. So these are some of the measures that have been put in place by NCDC and the Port Health to ensure that only persons that are COVID-19 negative are allowed into our country, Nigeria.
In 30 seconds, would you say that passengers fully understand the protocols that you put in place?
For the departing passengers, honestly, we don't have issues. They have been complying very well and adhering to the protocols and procedures we put in place. But a lot of our passengers coming in into the country are the ones that are really frustrated. We have seen some videos that are trending. People have been sending out all kinds of posts saying that they can't even access the portal in the first place. They have been frustrated. But all I need to tell our intending passengers is for them to just be patient. The portal will open. They will get these forms. Everything they need to do is done online. If they are patient, they will be able to access all of this information and do all that they need to do. Because if they don't have all of this with them, they will not be allowed into the country. So it will do them a world of good if they're patient enough to adhere to all of these things and do what they're expected to do without getting angry and frustrated at the system.
All right, we'd like to thank you for the clarifications. Mrs. Henrietta Yakubu, General Manager, Corporate Affairs, Department of the Federal Airports Authority of Nigeria, FAN. Thank you for joining us on the program.
Thank you for having me.
We have more updates when we return. Please stay with us. Welcome back. Ahead of the placement examination scheduled to hold September 26, 2020 for children in primary 6 classes and in line with the safety protocols directed by the NCDC, the Delta State government has distributed hand sanitizers, hand towels, infrared thermometers, liquid soap, face masks, among others, as materials necessary to help prevent the spread of COVID-19 in the state. Over 1,000 public primary schools across the state will be benefiting from the distribution as they prepare for resumption. The state government says proper monitoring exercise will be conducted to ensure that students and teachers are safe.
We have done our simulation, and that is why we have continued to do the phased resumption. Our simulation is such that we don't have more than 20 students in a class, and that is why we are bringing them in phases. So what we have done now is the materials that they need. They need hand sanitizer, they need their soap to wash their hands, and on a regular basis, you need to clean your chairs, in most cases with water and soap, to make sure you disinfect it by the time you come every day. We have made provision of some towels also for them to be able to do that, not for them to clean their hands. And we have also supplied them face masks and so many other things that they require. Infrared thermometer is also there to test and check the temperatures that the students are coming in.
Now, managing a complex crisis like COVID-19 can be challenging. Routine approaches, single-issue responses or action plans have not really been effective. For more on ways we can collaborate on strategic responses and also address the compliance challenges, whilst, of course, other considerations exist, we have in the studio Dr. Aino Oyikomi. She's a consultant psychiatrist. Thank you for joining us on the program.
Thank you, Millicent.
All right, so tell us, is there a science to compliance?
Yes, there is. And science does not lie. In the delivery of healthcare, non-compliance is not a new problem, so we are used to it because it's not easy to tell people don't do this, don't do that. Now, how do we tackle health problems? We have two prongs. It's either the curative one or the preventive one. And everybody knows that the preventive is better. But the preventive usually requires that you modify your lifestyle. And that is not too easy for people. I mean, people are already used to a certain way of life. And then you tell them, oh, don't do this, don't do that. And then bringing it back home to COVID. I mean, COVID safety protocol is attacking one of the central instinct of human existence, and that is social interaction. So it is not easy because we must put problems in perspective so that people would understand and then would prefer the right solution. And then the second one is that you're telling people to cover their noses. One fundamental thing also that people hold so dear is the freedom to breathe. And then you're now telling them to cover their noses. And then we know that the masks are not comfortable. And we have different degrees of mask. Some are more comfortable than the others. And for a place like Nigeria where there's so much poverty, a lot of people cannot afford the medical mask, which are more comfortable than the cloth mask. So now, how do we deal with non-compliance in the medical sphere? Yeah, the message you pass to your patient or to the client is important, but the ambience is also important, if not even more important than the message itself. So you have to pass that message in an atmosphere of trust, transparency, continuous, intensive education, respect, and clear communication. So there must be no ambiguity. So how do we now modify this, to use in this COVID pandemic, because children are resuming and they have to comply with the safety protocol? Number one, the messenger. We have the message and the messenger now. So we have the content and the context. So the messenger must be authoritative, must not be an authoritarian, but must be authoritative. So people usually, and this is the psychology of compliance, people usually would believe and comply with directives from figures that they feel are more legitimate in that enterprise, in that field. So who are the people talking to this, to Nigerians? Who are the people talking to us? Who are the people talking to the populace? They have to be people that people can trust. Trustable persons, people with integrity, people with honesty, that people can go home with whatever they say and sleep.
In about 40 seconds, we've had this virus with us over 6 months.
Yes.
With the messages we've been getting from the Presidential Task Force on COVID-19, state governments, have they been enough to get compliance from citizens?
Sometimes they have been contradictory because, I said clear communication. Communication is not only verbal, there is also non-verbal. So the same people that are telling people, observe social distance, do this, do that. We have seen videos, Nigerians have seen videos of the same persons attending ceremonies where there is no social distance. So you are telling them to comply. So we need to go back to the drawing table. This is modeling. You have to, you see, communication is even more non-verbal than verbal. Talk is cheap, but doing it is not cheap. So what I want is that let's the PTF or all this task force or whatever they call themselves, let them go back to the drawing table and do the needful. Let's not just stop. Let's stop deceiving ourselves.
All right, we'd like to appreciate your time. Thank you so much, consultant psychiatrist, Dr. Ainoye Komi. Thank you for joining us on the program.
Thank you for having me.
India has become the second country in the world after the United States to record 5 million COVID-19 cases, with the last 1 million coming in a world record time of 11 days. The grim milestone was reached on Tuesday when over 90,000 fresh infections were reported, while deaths rose by 1,275, the highest single-day toll reached so far.
The number of confirmed cases in India has surpassed 5 million, according to officials, with more than 80,000 people dead. India's rise in infections comes as the government continues to lift restrictions to try and boost the economy. The country has the second highest number of cases in the world after the US. A total of 81 schools have closed down in France after students tested positive for the virus, up from 28 schools early last week. The Education Ministry says a further 2,100 individual classes have also been called off. According to the ministry, classes are shut down as soon as there are 3 cases. In China, health authorities report 12 new confirmed cases of COVID-19 across the mainland on Tuesday, all of which were imported. 4 were reported in Sichuan, 2 in Shanghai and Fujian respectively, and 1 each in Zhejiang, Guangdong, Yunnan and Jiangxi, according to the National Health Commission's daily report.
For the first time in a long time, we have less than 1,000 active cases across our state, which is should be a point of pride for every single Victorian who's doing the right thing, making sacrifices, staying the course, doing what has to be done to get our state open and keep it open.
And Australia's Victoria State says the daily rise in infections in its coronavirus hotspot of Melbourne has eased further, putting it on course to relax an extended hard lockdown in the city by the end of the month. Average cases over the last 2 weeks in Melbourne, the state's largest city, fell below 50, which is the benchmark the state set to start easing the curbs.
For updates, take a look at our website. It has the latest updates on the pandemic. All you need to do is log on. It's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.